Okay, I hope this is working. We are having technical difficulties, so you don't actually see Dr. Coffman today. Hi, everybody. It's Alison Lebovitz. But I have him on a phone, on a second phone. So hopefully our fans can hear you, and we're gonna. This is, you know what? This is how we pivot, right? In COVID-19 times, there is no such thing as cannot do it. Okay, we're just gonna roll with the punches. We're gonna make this happen because we promised you a live show today at 3 o'clock. It's a little bit after. We apologize, but I have so many questions. So I know. Oh gosh, I'm seeing people. Let's see. Can you hear me? Okay. Yes. Okay. So people are watching. All right. If you're watching, please let me know if you can hear Dr. Kaufman when he talks. Okay. Let's get to it. Alan, how are you? You're good? Everything okay?
Good. I'm good. Congratulations on Abe's announcement. That's awesome.
Well, thank you. Yes. So Abe is he's one of the seniors who's not quite finishing his senior year the way he thought, but excited about going to Tulane. We hope he's going to be there in person. We hope. Yeah.
You guys will be eating well for the next 4 years, hopefully.
We only allow our boys to apply to schools in cities where we want to visit. So we've got one in Chicago. We've got one in New Orleans. All right, good. Thank you, Courtney and Shelly. Okay, you can hear him. Perfect. Okay, so this is working. We love it. Okay, as long as y'all can hear him. All right, so look, lots of questions. And you can see, boys and girls, I have on my reading glasses because the only way I'm going to be able to read your comments and follow along is if I keep these on. So there goes vanity out the window. All right. Let's talk a little. Let's start with the littles in our lives, right? The littles and the bigs, all right? And as I'm calling you to talk about COVID, and now I'm quoting you in my own household, I realize I may be giving my boys, and my boys are teenagers, I may be giving them too much information. So tell me a little bit, and we can start with the littles and go up. Number one, Dr. Coffman, how do we talk to our kids about COVID, right? How do we talk to them about the virus? And then what's too much information, right? It's almost like I feel like I'm like, it's like the sex talk again, right? Like we have a friend who once said, listen to the question before you give an answer. But, and I will just say our summer camp, the boys' overnight camp got canceled this week. And they said, don't worry, maybe we'll be able to do something at the end of summer. And I said, well, Dr. Coffman said this may last 18 to 24 months. And my 16-year-old said, great. And then, walked away and was very upset. So how do we talk to the littles, especially about COVID? How do we talk to our teens and older kids? What's too much information and how do we approach it?
Well, so all great questions. And I'm sorry you had to hit on the head like that. But the time on task is often grossly overestimated by parents on how long kids want to talk about something. So, the amount of time your kids want to talk to you peaks at about 8 and then decreases rapidly on both ends of the, as you go younger and older. And so, just like you said, I will often stop when I get a question and ask them a question, so what do you think, or what have you heard, or what are your questions? Just to get a better sense of what they're actually asking me. And then reassurances as much as you can. I think looking at the things that are stable. One thing I think in the younger children is really telling them that there's a lot of people working on this, that there's a lot of doctors and researchers and all kinds of people who are trying to help all of us live better and to not be affected by COVID-19. As much as you can, give them control. So that's where the schedules really help, trying to keep things as regular as possible. So meal times where we're coming together. I think all of us have experienced just a lack of appreciation of what time it is. It's just like living in a geriatric facility. I almost need a sign on the wall saying today is Sunday, and it's 3 o'clock. And so I try to keep regular occurrences in the daytime so that kids are cued to what time of day it is. And then often behavioral changes is what will signal across all ages that they're having trouble. So if you're seeing irritability, things that they normally like to do, they're not interested in. I had a long conversation with some folks this morning about just the increased amount of conflict in their house. Yeah. And that's normal when you're spending more time with other people. There's going to be more conflict. But when you're seeing big changes in just how irritable people are, the less resilient, that's a good sign that they need more time to talk. And then the last thing I would say is just be really careful about what information they are getting. So turning down the amount of social media and TV and news. Sometimes it's helpful to schedule a time to talk, and that's different. How often a kid needs to talk about this stuff varies from child to child, but saying, on Wednesdays and Sundays, we're going to talk about what we're doing around COVID, and the rest of the time be purposeful about not talking about it. Yeah. And each kid needs to do that more often. We'll put a couple links up on the chat afterwards in regards to some books. A good friend of ours, Melissa Gracious, whose husband was a former pediatric oncologist here in town, she's actually written a book called Captain Corona that's geared toward early elementary kids. And one of the things that she suggested, one of her ideas, was actually having a coronavirus scrapbook, where you're kind of making memories and recording those so that you can look back and kind of reminisce about this time. St. Jude's has a nice coloring book for younger children. There's a book called Coronavirus, a book for children that's real nice for like 3rd, 4th, 5th grade. And then there's a kid's comic book about coronavirus, and we'll put all those on the website.
I'm realizing, while we're pivoting, I think I can FaceTime you and then show you. Let's see if this works. And then I can actually show you instead of people looking. Now, I've got 2 screens. I'm very fancy. And I can actually show you to people while you're talking so they don't have to look at me the whole time. Oh, look at that. Okay, so look. So, hey! Do you like that? Oh my gosh. This is like, look. I've got me and Dr. Coffman in the same picture now. This is so cute. Oh my gosh, seriously. Okay, so so now we're gonna share the screen. Okay, I'm gonna pivot from me to you. So when we talk about this, right? Those are great suggestions. The scrapbook is a great idea, even though honestly I do want to scrap this whole year almost, but I'm gonna try not to. We mentioned summer camp last time, and I promised some of our viewers that we were going to get back to that. Let's talk about the safety of summer camp to the best of our ability. And I know some of our overnight camps have been canceled. Day camps are still pending. I know parents are starting to, look at going back to work. Those who can't work remotely, there's some parents who are already, on the front lines and are critical workers and are going back. How do we balance that, right, with the kids who will need childcare? Is it safer to get like a nanny or a manny? Is it safer to go to a neighbor's house? Is it safe to go to day camp? How can we pivot that way as social distancing becomes more social?
And there's a bunch of layers to that. We had talked earlier last week about what about family members that have jobs that are more at risk of being exposed to coronavirus. And so that'll be folks who are moving, so if retail's getting cranked back up and you have family members that are working in retail or working in restaurants or, are bus drivers, are in healthcare, that's going to be something to kind of keep in mind too, as you look at who and where your children are hanging out. And specifically with summer camps, the thing I would encourage parents with is it's going to change from week to week. What we're going to see is in a lot of communities, they're developing pretty rigid sliding scales around what should happen and what shouldn't happen. And so, initially there was some, 10 people can get together, 50 people can get together, 100 people can get together. And I would anticipate that we're going to see a lot of that for the near future. Right now, we have an experiment that's going on in Tennessee and Georgia where we're opening things back up, and I anticipate we'll see cases start to go back up in the next week, 2 weeks. I would remind everyone that it's going to be 5 to 7 days before we see symptomatology. And the real concern is the multiple spread. So if we were going to see a big bump from decreasing exposure or decreasing contact precautions, we're going to see that probably in more like 12 to 14 days. So that's a lot slower than most of us like to work. We like to know, what's going to be like tomorrow. And I think in regards to summer camps and in regards to daycare, every week is going to be a different situation. And so to your point about camps in July, who knows right now? I would, like we talked about on Wednesday, I would plan on doing those kinds of activities, but be very clear that we're going to reassess every week. A lot of it's going to depend on how good a job the camp does on adjusting to coronavirus. So what they're doing in regards to cleaning, what are they doing in regards to social distancing, especially in how they're going to structure sleep experiences and eating experiences. Camps where you're going to be outside and, so kind of an outward bound kind of thing would be very low risk. But when you're going to have 20 kids sleeping in the same cabin every night or eating around the same table every day, a little bit higher risk. A camp that's limited to this community, so something like Camp Vesper Point, where a majority of the campers all come from here locally, and if we're not having many local cases, that would be a safer experience. By the same token, there's a diabetes camp that's right next to Camp Vesper that kids come from all over the country. That would be a much higher risk if some of those children are coming from communities that have higher levels of coronavirus in the community. So I think as we talk about that, you'll start hearing more from camps about what are they doing, how are they structuring this. You'll have a lot of, just like they do a lice check when you come in, there'll be a symptom check. Has anybody been exposed to coronavirus or tested positive or had cough or fever? And then with daycares, I think you will see some daycares are talking about staggering, so where you'll decrease the number of kids that are at the daycare at one time. So we may have that they limit the number of kids to half, and they'll rotate. 1 week half the kids are there, and the next week the other half are there, just so it's easier to social distance. We may see camps do that too, where they radically decrease the amount of kids that can be at camp. And then I think it will depend on how good a job the families of the other children that are in your experience at daycare, what are they doing in regards to protecting themselves around coronavirus? So if sharing a nanny with 3 other families who are all being very careful about exposure is a much lower risk thing than being in a situation where we have 20 kids coming from all parts of the community and all kind of strata of experiences.
Well, I was going to say, since you mentioned Outward Bound, I know people are probably now running to the Outward Bound site to sign up for. It's gonna be inundated, and Denise had mentioned on our chat that actually one of the diabetes camp, I'm not sure if it's the one you were mentioning, but they actually just canceled. And we actually had another parent who specifically wanted to know, she has a child with diabetes, and I know that with that immunosuppression, they might be higher risk. Are there some tips that you can give to those parents who have children either with diabetes or with an underlying condition, and how they start to safely socialize, and especially during this summer?
Yeah, and I think we get a lot of questions about asthma, and the information right now is all over the place in regards to what we're seeing in case reports. I would give parents and really everyone a sense of pause as they look at a lot of the reporting around research. So what the scientific community is doing right now is releasing a lot of research before it's been peer reviewed. So that means if I were to do a research study, I would write it up, submit it to a publication. Experts in that field would just tear it up, try to look for problems and look for issues in what I had done, and then if it passed met that rigor, then it would be published, and then you'd have people from all over the world that would then tear it up and try to find problems with it, as well as reproduce the data. And when we have things where you have research that's been reproduced a bunch of times, then we'll say this is our then we start making clinical decisions, like recommending, to do or not do something. What you're seeing now is a lot of research that's being pre-released because everybody wants to know what everyone else is working on. And that makes it difficult when you're not a researcher to look at that data. And I think the media sometimes inappropriately will report some of this information, and then you have a lot of people will then amplify it based on reinforcing what they want to do. So when we look at children, it does appear that especially kind of preschool and early elementary children do not seem to have as many of the symptoms, as severe symptoms with coronavirus. Nobody really knows why. There's a lot of hypotheses. So is it because that they're exposed to a lot of these types of viruses normally as kind of common colds? Is it because their mucosal cells, the cells that line their nose and throat, are not as easily attacked by coronavirus? Most people feel like that probably children don't have as big of an immune response to these viruses. So just like if a 20-year-old gets mono, they tend to be a lot sicker than when an 8-year-old gets mono because of that same thing. They just don't make as big an immune response. And so when you look at kids who have chronic illnesses like asthma and diabetes and Crohn's disease and things of that nature, they are getting pretty sick when they get coronavirus because of that stress on the system. With asthma specifically, if you have mild asthma, so that would be a child who maybe is on a low-dose inhaled steroid, something like Flovent or Qvar. If they just need to do a albuterol when they play sports in the winter, that would be someone who probably would not have a significant increased risk of bad results with coronavirus, but definitely moderate to severe asthmatics, and then folks with diabetes. The hard part with diabetes is that because it generates some significant immune responses in older children, the sugar management gets quite difficult. So it would be similar to if they had the flu or had another significant illness and managing sugar levels.
Okay. So another thing, you were talking about testing, and all of a sudden it dawned on me that I keep hearing all of this stuff about not just testing, but testing for coronavirus, but also testing for antibodies, and then the possibility that you can donate plasma and be part of the cure. I'm going to just claim total ignorance here because I feel like, there's I thought that once you have coronavirus, you're, I guess, possibly immune to coronavirus, or at least a strand of coronavirus. And does that mean you automatically have the antibody? Could I have antibodies even though I theoretically never had any symptoms or knew I had coronavirus? Can you, I feel like these people with antibodies are going to be the newfound superheroes, right? They're going to be able to go anywhere and be maskless. And I mean, what's up with the antibodies, right?
Well, in fact, my oldest daughter, when this first started happening, back in March, her bright idea was to get infected on purpose so then she could take advantage of these really cheap airfares to Singapore and all these places she wanted to go. And so, talk her into that's probably not a good idea. But so the question with kind of immunity and antibodies, we don't know yet. And so there's a lot of speculation. I think, everyone's seeing a lot of media, a lot of reporting on these things. The government sped up the process of developing testing for antibodies, and so most of these tests are research grade. So there's communities that are working hard to test as many people as they can for antibodies to get some idea of to answer your exact questions of how many of us have been exposed to it, didn't know it. What do the symptoms really look like in retrospect? Do you have immunity after you get it? And those studies are very, very early. And we definitely know that a lot of this testing now is not very good. So we're working through what are the best ways to test antibodies. There's two kinds of antibodies that you'll hear people talk about. There's one that shows up in a couple weeks after you are infected, and then there's a second antibody that shows up in several months after you've been infected. And so you can look at antibodies with antibody testing and kind of get an idea of when you were exposed. And then the ones that you're seeing out now is that you can go to like an urgent care center, or you can get, they're not too useful, and they're definitely not helpful in regards to, am I sick right now? Should I stay away from my family? Can I go back to work? There's a lot of error, so a lot of false negatives and a lot of false positives. And so I would not, the formal recommendations from both the FDA and most of the major medical physician groups are to not base any individual recommendations on antibody tests. And so those are right now are pretty much just to be used for kind of this, how we look at communities and how they've been affected. And so we may see at some point that it reasonable that the antibody testing gets good enough by the time we go back to college that college students would have to have evidence of antibodies to be able to come back to college in the fall. That could be something that could potentially happen. But right now, I would not base any personal decisions on antibody testing. I would not spend any of my money on getting myself antibody tested. The tests that you see people getting for coronavirus, so if you go to the health department, that is what's called a PCR test, and it looks for the actual DNA, the RNA of the virus itself. So that's looking for that you actively have the genetic material of the virus in your nasopharynx. And that test is very dependent upon the person's efficacy that's doing it. And so the swab has to actually go all the way back to the back of your nasopharynx, which is way back here. That is not a comfortable test. If you have that test done and it's not that bad, then they didn't get a very good sample. And if you have a negative result, I would question that result. There was actually a article on the front page of the New York Times this morning about kind of the working, in the healthcare centers in New York. A lot of people are kind of doubting the negative COVID test, and they say if you have the symptoms, you have it, because there's so many false negatives.
It's a lot, right? It's a lot, but you are so helpful. I know we try to keep these short. I have no idea how long we've been talking, but I feel like it's at least maybe 15 minutes. Before we pivot to really sort of prompt everybody for what we're planning to talk about Wednesday, because I think that's going to be a really important conversation. I promise we will not have, I promise, the technical difficulties we had today, or at least we hope not. But before we pivot to that, to give them a heads up on that, I want to ask a question that's really on, I think, every parent's mind, which is, Mama needs a haircut. And can I go to my salon in like 2 weeks, 3 weeks, if I've gotten a list of very, stringent safety precautions that they're going to take, right? Like mine sent out one. They're supposedly like I might be able to go in 2 weeks. They're wearing gloves and masks. They're taking temperatures. We have to wear masks, one client at a time. There will be no hair blowing. It's like they're minimizing the interaction. Is this something that I should even be getting my hopes up about? Or should I just think about wearing a ponytail and and a hat for the rest of the summer? Give it to me straight, because I need to prepare myself.
Well, so that data is going to be developing over the next 2 weeks as we go along. The hope is that we'll continue to see the local daily case rate decline. If that makes a big jump, that may not be the best thing to do. If it stays where it's at, I think all of those recommendations are good. As you go into that situation, with you wearing a mask, you're protecting everyone that's there. And so if you have restaurants, if you have retail locations, I was in the Carniceria in Hickson yesterday, and they had a sign up that tomorrow they're going to start requiring everyone wearing masks. And so those kinds of locations are much safer to be in, because you're not going to have everyone shedding virus on the surfaces in those places. So as you go to the salon, if they're requiring that, then those common surfaces the odds that they're contaminated much lower. The decreasing the generalized spread of hair and those kinds of things, that will definitely help. And then being very careful when you leave those places to use hand sanitizer. If you can, wash your hands with soap and water, much better. And then as you get home, keeping your home protected. So, removing those clothes, taking a shower, washing your hands real well before you come back into the shared surfaces of your family.
Okay. And, you mentioned the mask. I don't think it's too many times to say what you said, Dr. Coffman, which is wear a mask, a cloth mask, a bandana, something to cover, your nose, your mouth in case you sneeze. And I say this to everybody, and I know it's on everybody's social media who's wearing it, that it's not about, I have no illusion that the mask is going to actually protect me from the virus. It's more about protecting the people around me. And I'm really cognizant of that. I think we'll get into this, and this is going to lead us into our discussion Wednesday, but I'm seeing a lot of posts about mask shaming already, right? Like that there's a delineation when you walk into a grocery store, a hardware store, whatever it might be, the people who are wearing masks and the people who are not. And there's definitely, it's causing some tension tension. I think that tension's just adding to our anxiety as a whole, right? Like with our kids, especially, like looking out for those signs of anxiety and depression more so than usual. How do we contend with that? I know anecdotally, you've been getting a lot of questions about that. You've talked to some friends of yours who are experts in the field. Are we going to be able to see them and have them on our call on Wednesday?
Yeah. So just so you guys know, when pediatricians get anxious, they call their psychologist friends, and especially, I'm fortunate I have two who are married, and one likes wine and one likes bourbon, so they work for wine and bourbon. So, but Kim and Jeff Eckert are two local clinicians who are experts in anxiety and resiliency, and their clinic is called Roots, and it's in Red Bank, and they have another location on the east side of the county. They are going to be on the next 3 Wednesdays. So Kim is going to be with us Wednesday at 12:30 to talk about anxiety, and a lot of just coming to terms with a lot of low-grade anxiety that all of us are dealing with. Some of us are having moderate to high-level anxiety. And then just when you have anxiety, all the normal things that you try to balance and struggle with every day tend to get exacerbated. You don't sleep as well. Your temper is shorter. Everyone, has a harder time communicating. And so she's going to help talk us through that, give us a couple exercises that you and I can work on together while we're on to help relieve our own anxiety. I think the thing I would leave us with today is, like we talked about Wednesday, just being kind and controlling what you can control. So in regards to the mask, what the whole goal moving forward is that as we have coronavirus move into our community, we're going to have a lot of things like we saw just this weekend. So at Orange Grove, they had a bunch of cases that popped up this weekend. We had an elder care facility in Athens, Tennessee that had a bunch of cases this week. And then last weekend in Blount County, one of the correctional facilities had over 500 cases. So we're going to see these little episodes where we have a bunch of things popping up. And the whole purpose of masks is just to help us not spread it when it does pop up. And I can control that. I can wear my mask. That's part of how I'm trying to be kind to everyone around me. I'm around a lot of people, and I don't want to give it to anyone else. That makes me feel better at the end of the day because I feel like I'm doing something to help my community. I can't control other people, so I'm not going to worry about it. But I think, as we do that, really enjoy doing what you can to help our town be a little more resilient to this, help protect people like Denise's lovely daughter who has diabetes, and to make sure that we're doing best by our friends and family.
Well, look, I'm going to put you next to me. We know that your kindness extends far beyond your mask. You extend that grace and gratitude to everyone you meet and everyone that is around you. And that is why I'm so thankful that you allow me to call you now twice a week. I'm so happy I have Dr. Coffman on my speed dial. It's the best ever. And so, and thank you. I know for all of you who are still watching or will be watching, this is it's like me and mini Dr. Coffman. I love it. Yes. It's, this is an unusual way to do it, but
as my head has ever looked.
And my husband will say, your head's never always been that big. So, look, this is just proof that we are dedicated to having these really critical and candid conversations about COVID-19, to sharing them with as many people as we can. And if you have more questions, send us a message, type it in our Facebook page. Don't forget, Wednesday, 12:30 p.m. Eastern Standard Time, we'll be talking with Kim about anxiety for the next 3 Wednesdays at least, and also answering whatever questions you have. Dr. Coffman, thanks for letting me call.
You're welcome. Thank you, Alice. It's always good to talk to you.
Always good to see you. And all of you out there, we'll see you next time.